So let me begin with our introductions. Our first panelist is Brenda Lee Viveros, and she is a Principal Public Health Promotion Specialist at the Rhode Island Department of Health. She is the Program Manager for the CDC Environmental Health Specialist Network grant and the Rapid Response Team Supervisor. Prior to her current role, Brenda Lee conducted environmental assessments during all outbreak investigations in Rhode Island. Our second panelist today is DJ Douglas Irving, who is an environmental health specialist for the Tennessee Department of Health. Prior to joining the Tennessee Department of Health, he spent 5 years with the Metro Public Health Department in Nashville. He obtained an MPH in epidemiology in 2015 and his REHS in 2017. Since 2016, DJ has been with the Tennessee Department of Health in the Foodborne program and is responsible for the implementations of the National Environmental Assessment Reporting System, NEARS, and providing foodborne outbreak support and performing food safety research funded through CDC's EHS Net Fund, or food program, sorry. Apparently day 4, I'm getting tired. Dyer is our third speaker, and he has an MS and RS and is a Health and Environmental Investigator 3 at Public Health, Seattle, King County, and has over 20 years experience in environmental health programs in Washington State and Minnesota. In his current role, Doug is a senior technical lead in the Food and Facilities Program. His primary responsibilities including coordinating the foodborne illness investigation team, food inspection staff trainings, conformance with the U.S. Food and Drug Administration's retail program standards, and quality assurance and quality control activities. Doug received his Bachelor of Science in Fisheries Management from the University of Minnesota, Twin Cities, and Master of Science in Environmental Public Health from the University of Wisconsin, Eau Claire. Well, the first question we have for the panel today is, what are some of the best practices your program has for investigating foodborne illness that you think would be of interest to other programs across the country? Anyone want to go first, or I'm just going to take a guess? I am seeing DJ smile, so DJ, you might win.
That's a nervous smile, Steve. I'm just kidding. Yeah, so as far as, I think probably the core best practices that we have is we have a very defined and cohesive outbreak team. And that team includes all 3 legs of the stool. Some people say 4 legs, but we have our foodborne EPIs and our state public health lab partners, as well as environmentalists that are a well-defined outbreak team. And I know this is a question that comes up later, but we attend weekly meetings together. We all have each other's cell numbers in our phones. If something comes up, I have 4 or 5 different lab contacts I can reach out to inquire about conducting environmental sampling, giving them a heads up to set up their benches. And at the onset of the outbreaks, it's very well defined what our communication flows are going to be, who's the outbreak lead, and what each person's expectations are. So I think having that kind of core cohesive team that's well defined, and you're meeting on a routine basis, even when there's not outbreaks going on, working on some of your program improvement initiatives, working on best practices or improvements based off of your after action reviews from previous outbreaks. There's always something for our team to work on to maintain our cohesiveness, but to also continue to improve. So even if there's not an outbreak going on, we still have plenty of work to do, and we're always focused on continual improvement. So that's one thing, and I'll kick it off to the others for now.
Doug, how about you? What would you suggest?
Yeah, similar to DJ, what we have at Public Health Seattle King County is, we call it the FIT, so Foodborne Illness Investigation Team. And really what this is a team that spans the more experienced field investigators who are really motivated to work on outbreaks, as well as the senior field operations folks and senior technical leads like myself. So what it really does is it kind of builds in a more experienced level of expertise and motivation, which I think we all know working on outbreaks can be quite tense. oftentimes. So it takes, I think, a certain personality to really embrace it, go out and do the work with the operator, certainly to assess what's happening and break any potential chain of transmission and protect public health. And then similarly to what DJ described, a big part of what we do is make sure that we do implement things like we do a pre-deployment meeting. So we partner really close with our communicable disease epidemiology folks. We make sure we have a clear understanding of what the intent of the outbreak investigation request is, what the suspected causative agent is. We meet before we deploy to the field. We have what we call our FBI Go Kit, which has all the necessary resources and materials for the team that's going to be deployed out to the field. We're in constant communication during the investigation. And then also at King County, we do a public disclosure. So oftentimes we're going to disclose that, certainly if it's a probable or confirmed outbreak, we're going to disclose it. So that's a tough conversation to have with an operator, but it's one that's necessary and it's something that we do. And then we do a post-deployment meeting / disclosure meeting. So we talk about everything, we talk it through, make sure we have all the necessary information so that when we do the disclosure, we're not, putting anything out there that's necessarily untrue or unfactual. And then training. So when we're not working on outbreaks, and certainly we've been derailed like everybody else by COVID-19, but the plan is to get back on track and do hot washes, quarterly trainings. We have our epi folks do disease-specific presentations. I just think that kind of constant quality improvement is really important.
Brenda Lee, how about you?
Yes, thank you. So I was going to talk a little bit about what DJ and Doug talked about, but I will discuss some best practices that we've successfully used during the investigation. So some of those practices are, conducting detailed food flows, requesting shopper card information, and then, routinely collecting environmental and food samples during the investigation. So for food flows, I think it's really important to not only, verbally go through the process, but to walk through that process with them, because oftentimes we find that, what they verbally tell us may be slightly different from their actual practice. And sometimes it's those small details, that may be key to solving the outbreak. With samples, collecting them routinely not only can help identify the source of illness, but also eliminate it, right? So if we get a positive food sample, there may be a recall and it kind of takes that product off the market. So no one else gets sick. If it's something like listeria, where we're swabbing equipment and we find a positive, we can either clean that equipment, or if it's something that can't be properly cleaned, get rid of that equipment so no one else can get sick. So I think that's also a very valuable tool. And in shopper card information, we've used that multiple times during investigations, and it's helpful because it's really difficult for people to remember what they had, right? So not everyone has a perfect food diary of what they've consumed over the last several days. So I think it's really helpful, especially if they eat multiple different foods and different brands. It's good for us, especially, in multi-state outbreaks. It's come in handy where we've requested the information and found that they did have the product, or maybe they didn't remember having the product. So that's another valuable tool that we have. And then, lastly, and probably most importantly, always kind of striving to identify a contributing factor and environmental antecedent. And I think, some of the best practices that I mentioned help us identify that. But I think having that goal, is important, because, if you don't understand why an outbreak occurred and how it happened, then how do you put the appropriate control measures in place? So I think, a best practice is always striving to identify those. And of course, that's not always possible. And, it's frustrating when you can't solve what happened, but I think that's, having that goal and working with your lab and epi to work together and put the, all the evidence, so to speak, together to help identify those contributing factors and environmental antecedents, I think are really important to see the big picture, and of course, to prevent it from happening again.
So Brenda, Brenda Lee, can we ask you one question? The other two mentions a specialized team. I'm taking it Rhode Island's doing that also?
So we actually started with a specialized team, and over time we are small. So we have been fortunate enough to kind of expand to our whole office. And so we have trained all our staff. We found when we had a small specialized team at the beginning, and sometimes it was difficult, obviously outbreaks always happen, they're unexpected and unscheduled. So, we would find that maybe that person was busy or they were, on vacation or something. But we are fortunate that because we're small, we have cross-trained everybody and kind of expanded our rapid response team throughout the office. But with that said, we do have seniors who kind of, have that experience and that specialized training that always go out during an investigation. So we are a little different, but still kind of the same idea.
Yep. Oh, that's awesome. So let's move on to the second question, which is, I think all of you already mentioned one of your tips here, or a few of your tips, but what are some of the tips and best practices you would, that maybe aren't easily thought of, or wasn't something you expected to be important in investigating foodborne illness? We'll start with Doug on this question.
I think really, I think having our investigators bring along a copy of the NIRS form with them and actually start collecting data, because oftentimes that sort of allows you to maybe ask some more informed questions. And then secondly, think about what happened and try to think of it within a retrospective sort of sense. So something obviously happened at a facility, and I think a classic example is a norovirus outbreak that we worked on a couple weeks ago. Is, oftentimes you don't get the actual complaint information until days after it's occurred. So you can go to a facility and you can see and observe, and you think, yeah, they're doing a pretty good job of washing their hands. The person in charge seems to understand, employee illness symptoms that would exclude someone from working, and they're not, they're using gloves or other barriers, so there's no bare hand contact. But obviously something happened days ago. And so it's understanding how to ask questions to the person in charge and staff. What was different last week than what I'm seeing today? And I think that's probably one of the biggest pieces of advice I can give any health department is to try to put yourself back in time when you're out in the field to figure out what happened, not what you're currently seeing, which is equally, it's important because it could be an indication of what happened in the past, especially if things are going terribly wrong. But if they're not going wrong, it's just trying to think retrospectively. I think that's one big thing.
Brenda Lee, how about you?
Yeah, so a couple of the tips that I was going to give are kind of already mentioned, but relationship building, I think that's so important because I think you don't, there's so many things that you don't think of ahead of time, right? That, how are you going to communicate? Can you share information? All these different things like outbreak plans kind of outline for you. So without that, having that ahead of time and building those relationships ahead of time, it can cause delays in the response. So I think that's a huge tip. Another tip that I think is really important is when you are investigating a establishment, looking at the history of the establishment, right? So going through previous inspections, do they have a lot of complaints? Do they have a lot of violations? If you're looking at something like norovirus, do they have a history of bare hand contact and not washing hands properly? So I think that's really important as well. And then I think the last tip that I would give is after action reports or reviews. It doesn't always have to be a big formal meeting or this really long after action review, but even sending out a simple survey to people, to everyone that responded to the investigation, just saying what went well and what didn't go well is really important. And including, everyone from inspectors to management is important because everyone gives a different perspective, right? So me in the office, I don't know what went well or didn't go well out in the field, right? Did they have the appropriate equipment? Did they have everything they needed? So I think it's important getting all that feedback. We have used that a lot to improve our policies and procedures on things that we wouldn't have, I wouldn't have thought of necessarily. So, even small things like creating a guidance document for the future or a template. So there's a lot of good things that can come out of even sending a simple survey, to everyone, just saying, what went well, what didn't go well, and what would you suggest for improvement? So it's really great to get feedback from the whole team.
Yeah, I was just going to even circle back to Brenda Lee's comment earlier about, training of the EH staff across the state. We do have a core centralized team, but we're kind of a mixed model. So we do, it is required that all of our field office managers take the CDC's EATS training series on the environmental assessment training series. And then we do intrastate training in our different health regions. So at least and we have 8 different health regions, and each one of those regions is a field office manager, and at least that person is trained on doing environmental assessments. When we identify an outbreak, we reach out directly to that field office manager and we offer up any support that they want. If they just want to bounce ideas off of us and kick around ideas before they hit the field, we'll do that. A lot of times they want us, on the ground with them, which I think leads into my next point, in that one of the best tips I think for doing environmental assessment is to not go it alone. You need a team to go in there. If you've ever tried to do an environmental assessment, and not even talking about sampling, right? You definitely want a team for sampling. But if you've ever tried to do one on your own and not having a second set of eyes in the facility or a third set of eyes with you, you're going to miss stuff. I don't care how smart you are, if you have a photographic memory, there's going to be things going on in the background that you're simply going to miss. For example, if you're sitting down with the manager conducting an interview, it can take a long time. If you have another person with you, you can begin an interview and have that other person start doing a facility walkthrough, getting a lay of the land, maybe having some small talk with some of the employees there. Maybe you're focused on a particular food or production area. They can go ahead and begin talking to folks about how that food's prepared there and looking at the conditions while you're doing some other activities. And then you can join back up together, reconvene, and walk through the facility together. But not going it alone is a big one for us. And then, going back to that training piece, a lot of our health regions are very rural, and they may not have an outbreak for, a year, 2 years. And then if they do, it's going to be 1 or 2 people, 2 or 3 people, environmentalists that go in and actually do that activity of doing the EA. So, training, we're very aware training's not a one-stop shop, and it's a continual thing. You don't go to, you don't train for emergencies once and then wait 10 years for that emergency to happen. You're constantly, updating your training, reiterating your training. And so, for us, we're in the stage now of setting that cadence for, okay, we know we were in this health region 2 years ago. There's staff turnover. There's people that need updated training. And what's our plan for how we're going to, reiterate and provide this training again to new staff and staff that may not have had that training in a long time.
So all 3 of you, I'm going to go off the script again, so watch out. That'll happen a few times. Mentioned training. DJ, you specifically mentioned the EATS training, for example, as something that you use as a core training for your key people. What other trainings are you all looking at for your key folks? Are there others that you would say, boy, this is really important to our program to take this training? Maybe we'll start with Brenda Lee.
So we also do the EATS training, the 101 and 102. We do sampling training. One training that I think has worked really well is having a foodborne illness outbreak plan training, where our lab, epi, and environmental health actually come together and kind of go through it together. That's been really helpful, so that, even inspectors in the field can see the epi and lab perspective, because sometimes they don't always get that when they're out in the field, right? They only, kind of see that environmental health component. And then also, we do a tabletop exercise every year, which I think is also really valuable. Practicing that, sometimes, definitely not this year, but sometimes there are years where there's not a lot of outbreaks and it's a little bit slower. And so, making sure that you're keeping up with those policies and procedures so that you know how to use them when an event does occur. So I think those are probably some of our most valuable trainings for outbreaks.
Doug, how about training for Seattle King County?
Yeah, similarly. So each training, of course, any specialized training that might be offered by FDA, creating our own scenarios and tabletop exercises. So taking past, I certainly, can recall, quite a few outbreaks, which make great case studies, and just tweak them a little bit, and have a group exercise working on that. So also in the state of Washington, we're decentralized. So each county has a board of health and therefore has a health department, but our state does have a food safety team. And the food safety team offers this wonderful new inspector training annually, at least annually, and sometimes twice a year, where that in part is covered: foodborne illness outbreaks, causative agents, outbreak investigations, and it's held at our state lab. So it's kind of cool, because from a food sampling perspective, then you can see where lab samples are analyzed. You can talk to the team that works on those samples. And so it kind of ties it together real neatly. And it's not just for new inspectors, but certainly experienced folks who may be coming to Washington for the first time can attend the training. So that's and then of course Washington's RRT Rapid Response Team, which is a multi-jurisdictional state and local, also offers some really great opportunities for talking about certainly foodborne illness scenarios that span a much larger geographic scale than just say a county, for example.
Oh, that's awesome. So I think if I took a tip out of this, I think all of you would say, go take EATS training first. I think that we hear a very common approach there, along with specialized training, and sampling seems to be a key theme amongst all of you. We've heard that, which I think are no surprise to anyone here, that those are important areas. I was just going to, I'm writing so many questions, we might need a second hour. I'm sure Pat won't give me that, but just as we were talking, there's some great questions that have just been coming to mind. But let's talk about something that hasn't worked. So all of us, I think, have had those experiences where we've had this wonderful idea and it wasn't quite as wonderful as we had hoped it would be. DJ, do you want to start and talk about something that you would not suggest for others try?
Yeah, early on when I was starting to do these investigations, you see a complaint come in, maybe a group illness, and you're pretty certain something's going on, and your kind of knee-jerk reaction is, I need to get out there right now and full throttle on the speed and just kind of running, into the restaurant and kind of and not be organized and very well organized. I was more focused on the speed of getting there. What's my response time? How quickly can I get into this firm? And I learned quickly that sometimes that's not the best approach. And I think we all go through this. We want to get in there. We want to figure out what the problem is. We want to get control measures in place as quickly as possible, and we want to prevent illness. And that's really where the rubber meets the road. That's the EH function in these outbreaks is what it's all about. That's where we get change. That's where we prevent further illnesses. And there's such a plethora of information available at your fingertips to prepare you for that site visit. That's going to make it a lot more productive. And you really, that first site visit is so crucial. From my own personal experience, and I've talked to others that have experienced the same thing, that first site visit is really where we can get the lion's share of our information. The managers or, the facility hasn't kind of huddle together and be like, okay, well, this is going to be our action plan, and this is what we're going to give or not give, the inspectors, and we're able to garner a lot of information. And if you plan well before that first site visit, it's going to, I think you're going to be able to get a lot more accurate information, and B, you're simply just not going to miss stuff, right? There's a number of times I rushed in to do an environmental assessment, and then I get back and I debrief the outbreak team, and Epi says, oh, did you Did you ask about, employee sick logs? Did you look at, their reservation apps to try to get case information? And did you look at this and then, or I didn't research the pathogen, the suspected pathogen that well, or do a good job on menu reviews and totally miss an interesting item on the menu that goes through multiple steps, and that's a complex food that I oversaw. That simple online menu review, I would have noted that item and been like, hey, this is my plan, this is what I want to look at. So I think when that outbreak first comes into you, or that first complaint, it looks like something's going on, take a breath, sit back, consult with your outbreak team, trying to get all the available information that you have, and then taking the time to do inspection reviews and menu reviews, talking to the routine inspector that goes out there if they have any pointers, can really help prepare you for that first site visit, so you can get a lot of that good information without ending up having to go back to the facility to get that same information on multiple trips.
So DJ, just out of curiosity, do you all, while you're in the facility, maybe do a call back to the team and do a quick call and talk through with what you've done? You're a big state, that's why I asked that. I suspect there's a lot of windshield time there.
Yeah, there's a lot of, maybe not initially when I first started it, but now there's a lot of texting and phone calls and things like that going on. So yeah, we're texting back and forth with our Epi team, and then our lab partners. If I'm, one thing I always do now, regardless of where we're at in the investigation, I always have, 3 or 4 stool kits on me.
Oh, yeah.
In case I identify an ill employee, that's a no-brainer. You get somebody that's reported an illness and they're in there, even if they've recovered from their symptoms and you're in there, a few days after the exposure, we're still able to identify, pathogens in their specimen even after they recovered. So I have a stool kit ready to go. If I'm able to secure one or get one to somebody, I'll let our lab and our Epi team know. But yeah, definitely, there's a number of times where I'll reach out to our Epi lead and be like, oh, did you talk to so-and-so? Could you explain to me again exactly what food because I might get in there and based on the initial complaint or interviews that our Epis have done, there might be multiple food items that's similar to what that person's reporting, and we'll
Well, DJ, we seem to be losing you just a little bit, so I'm going to move over to Doug now.
Yeah,
Doug,
I think.
Go ahead.
Yeah, I think for us, just not having a fit team originally, and forming the fit team was just immensely helpful. So just not going. I mean, much to what DJ said. I think we experienced some similar stuff. Is just you can get so much more if you go in with a trained team and a plan than not. And then I would say too, trust your epidemiologists. I mean, they do a lot of legwork. You might not be under the same roof, but they do a lot of legwork and have, in my experience, a passion and a real knowledge for hypothesizing what it may be. So if it's viral or bacterial, and that's meaningful information. And what we've done is we've created field focus guides. So if we know, for example, that it looks like a bacterial toxin, we wouldn't necessarily do the same kind of investigation that we would do for norovirus, right? We'd have a little bit different focus. And I think you can get a lot from that. And I think what it allows you to do is it allows you to spend your time more meaningfully. And then also, with a trained team versus when we didn't necessarily have that, was there's a better opportunity to have multiple people out there so that you can diffuse any tension that may occur. So part of what we want to do going forward is really explore this, more of de-escalation type training, learning more things that we can take out into the field. So as all of you know, operators can get, defensive. It's their business, right? And you're perceived as someone who's, somehow negatively affecting their business. Even if you go in there with the best intentions and the best interpersonal communication skills, I think that's probably something that, we definitely want to strive more towards, is kind of building up our de-escalation experience and practicing that out in the field. And so I would say, I think those things too would, definitely, when that wasn't in place or thought about, I think made things a little bit more difficult. And I don't know that you would necessarily be able to be as effective. I think, as certainly we be effective as we are now. I would say that's just a couple of things.
Yep. Brenda Lee, how about Rhode Island?
Yeah, I would say, and I think someone mentioned this earlier, but one thing that consistently doesn't work for us is sending only one person out during an investigation. There's just so much to do during an investigation that, you really need the two people. A lot of times we send one people where they come back and, it's not their fault. They were trying to take on so much, but we're missing information. So, it also helps one person can kind of focus on maybe the hazards that are there and implementing control measures, while the other person is, interviewing food workers or the manager or collecting invoices. So I think, there's times where maybe we're short-staffed and we're like, well, let's just send this one person, and consistently it just doesn't work. And we find that things go much smoother and we get the information that we need when we send at least two people. For us, we do that senior inspector with an inspector. Another thing that we have found is kind of similar to what DJ was speaking to earlier, but when you are really rushing out the door and maybe the inspector doesn't have all the information, and then you end up, and I've been on both sides of this, where I've been out in the field and got all these phone calls, where you're calling the inspector every couple minutes updating them, and so it's confusing for them and distracting, and I've also been on the side of making too many phone calls to the inspector while they're trying to investigate. So I think having a meeting before they go out to be able to give them all the information. What we've done in some cases where we really want to move quickly is said, hey, let's get one person there as soon as we can and kind of brief maybe the senior inspector and have them grab the equipment they need. So we are getting someone there quickly, but making sure they have that information that they need, because that is really valuable to them. And when we're trying to call them every 5 minutes, it's distracting for them, and they're probably more likely to forget to do something. So I think, having that debrief meeting with them before they go out to make sure that they have all the appropriate information is important.
Yeah, absolutely. So it's interesting. I've been getting a list of things that all of you have said that are the same, and we're hearing a lot of very consistent items, which might be a good sign that this might be some good advice for others that are on this webinar at this meeting with us today. The next question that we had was, does your program, well, we actually covered the specialized investigation team, but what what traits are you looking for in those key investigators as you're doing that? I think Doug, you talked a little bit about some of the things that are important in that. I'd be interested, maybe you want to elaborate, and others have some things that they would like to add to that.
Yeah, I think for us, what we've initially building the team, it was just reaching out. We're a fairly large health department, so we have about 60 staff total, and about 45 of those are field investigators, and we have an additional about 7 or 8 senior lead positions. So initially just started out with who's interested. And it's great, it's a luxury to have that many people, because you're just going to get a certain number of people who, that's their personality, they're interested in. They like to jump right into the fire. So I think sometimes that's hard to build into people. So for us, it was reaching out and finding out who's really interested. And then for us seniors, it's just part and parcel of what we do. So we're certainly involved, and I think most of us are interested anyway, so that's not too much of a hurdle. But then, what we thought about is going forward, how do we integrate in newer staff? So maybe staff that, are 5 years or less with the program. How do we sort of get them interested in this so that we always have a cohort that we can pull from? So that's part of, right from the hiring through the training process, that's another, thing we look for is, do we think this person would be interested? Because at some point, we want to get them into the fit team. We want to make sure we always have a good dynamic team, a team that's inquisitive, a team that's interested, a team that enjoys taking trainings, and a team that really understands that, when there's an outbreak, you basically drop everything else. If you had other things scheduled for the day, you just have to pivot and reschedule. And the task at hand is working on the outbreak. So that's kind of what we've done and what we look for. And, knowing that, again, enthusiasm is sort of, part of the person's, part of their persona, rather than you're trying to take someone who's not enthusiastic and trying to build it into them.
Yeah, with my experience also, that once we realize not everyone is going to be perfect at or great at this, let's find the people that when they go out, they really do an amazing job, ask the questions, and find what's happening. Those folks were just so much more effective. So Brenda, how about you? Brenda Lee, anything you'd like to add there?
Yeah, I think, critical thinking is really important out in the field because, we can write a plan and we can say, do these 5 steps, but, they're the eyes out in the field. They're really seeing what's going on. And so being able to kind of anticipate what to ask next, or, really like looking for those why did that happen, and asking the right questions. And so, even when it comes to sampling, sometimes we can tell you what to sample, but you may see something and say, what, this is really good. This is probably an important sample to take. So that critical thinking is really important in the investigations because, we can write these plans, but, we can't predict what's happening out in the field and we can't see it. So it's important to have somebody who, when they notice those things, thinks about, what we might want to do next, given that situation. So I think that's really important. And then also communication, making sure people are speaking with the right tone. And I know someone, mentioned earlier that, sometimes people can get angry, right? It's their restaurant, it's their livelihood. And so, speaking to them in a manner that you can communicate the message, but in an appropriate tone so that you're not making them angry, or that you can, de-escalate the situation. So I think, clear communication is important as well, whether it's, de-escalating the situation or clearly communicating, the message and what control measures are expected, or, asking the right questions too.
DJ, anything you'd like to add?
So our structure, how we're set up, all of our field office managers are trained. This is our environmental health, and then they usually have a few district supervisors under them. They're all required to, have an internal assessment training, not only through the EATS training, but then the regional trainings that we do. But it really depends on them. We're also fortunate enough to have 2 environmental health specialists network CC funded folks in the state. I'm funded under the CDC SNet grant, and I'm positioned in the middle of the state, and then Dave Ripley is funded me, and he's stationed in Eastern Tennessee. So between him and I, we're able to get full state coverage, be able to get to any part in our territory within 2 to 3 hours for the most part. So we're really fortunate to have that. I don't know what we would look like if we didn't have that resource, and so that is a driver in our abilities to have more standardized foodborne illness out investigation on our side. And then, kind of circling back to the training, and I might be around a little bit, but something I wanted to mention, we use outbreak investigations as grounds as well. Especially if it's an area or a location that has a new inspector in it and it's their territory. We want them to come along with us, and we want them to learn firsthand, boots on the ground experience. There's nothing that can replicate that. So we also use outbreaks themselves as testing, as training grounds. So that's really important. And really, both touched on this a second ago, talking and again, sorry for veering around, but I think it's an important point that communication piece with the facility is important. One thing we strive to do when we get there is we sit down with the owner, the person in charge at the time, and really at a high level, try to explain to them what our processes are and give them, a just-in-time training for what it is that we do. And we really want to take that and go, hey, this is why we're here. This is how we found out about what's going on, and give them some details about our investigation. Obviously there's things we can't share, but we share as much as we possibly can with the firm. And that gives them an idea of why we landed there on that day. We give them a high level overview of what whole genome sequencing is. If pathogen surveillance is what led us there, we educate them a little on what that means. What does it mean when, two strains are of salmonella are virtually identical, and that what we're doing isn't a random thing, that all the decisions and everything we're doing are based off of the science that we have, the data that is coming in, the case interviews that are going on, or if they haven't gone on, we'll let them know, hey, we're going to be doing people, we're going to be running analytics on their exposure, and and we're going to be collecting samples and specimens, and you're not going to be implicated if the science doesn't lead us there. We're not just going to say, oh, we're pretty sure it's you, so the hammer's going to come down on you guys, and we're going to require you close shop and do sanitize your whole restaurant. Like, we don't do these things on a whim. They're always driven by the data and the science coming in from our laboratory and our epidemiologists. So taking that time up front to give them a little tutorial on your job, you tend to get a lot of buy-in. And then one thing I always like to communicate to the managers is that, look, one of the worst things you can do is to not cooperate. We want to prevent further illnesses from happening, and we know you want that too. If we don't address this situation head on, and this outbreak expands and blows up and we get more cases, you're going to be in a lot worse situation than you could be in a lot worse situation than you are in right now. So let's work together as a team. So we can either rule you out, or if we do identify something, us working together is really going to get this outbreak under control and prevent further spread. And I think taking that time and effort at the onset to explain those things, really gets buy-in, and it lets them know that you're not just there as this kind of regulatory authority, but you're there to help them solve a potential problem as well. And you want to work as a team together.
Yeah. No, I think that's a great point, DJ. I can think that when we're in those outbreak situations, how many times we spent that extra time educating the operator, or even we see the same things when it's a larger multi-entity outbreak. Sometimes just getting everyone together with them to walk through the questions that they have, whether it's about the epidemiology that's going on or whatever, that can be very, very helpful and worthwhile. So I think the education part is something that we can't miss for the operators. That takes me to another question that I just want to ask you all. So I know a challenging question for regulators, particularly, is when do we start having the conversation of what happens next, and how do we bring that up? And I think everyone may have slightly different positions, but how do you all approach that, whether it be a potential norovirus situation or when you might need a product recall, et cetera? When do you start that conversation? How much information do you need before you start that conversation? Kind of walk us through your thought process. And I might start this one with Brenda Lee. Are you willing to start this? I know no one has found more outbreaks than probably Rhode Island.
So next steps as in like, how do we make decisions as we go, basically?
Yeah, how do you have those conversations with operators, and do you, yeah, kind of that, as you're
Yeah.
working through that? Yep.
So I think a couple of things that we do is, one, we try to really communicate between our lab, epi, and environmental health, so that we're all on the right track, right? So whether we collected food samples or we collected, stool samples and had positive and need to exclude people, we kind of sit together and have conversations so that we're all on the same page and in agreement with the decision and next step that's being made. And then, of course, preparing for if there's like any media, if it hits the media or something like that. We want to make sure that our message is consistent. And then when we're dealing with, the establishment and kind of talking about next steps, we usually try to have one person consistently communicate with the establishment so that it really, they build that relationship with them, and they're not getting multiple messages from different people. And we really, I think someone mentioned this before, but try to, explain the science and what's going on, and that, we're not just doing a recall because we think there's something wrong with the product. We would, if it was a food or something that needed to be recalled, we would obviously, share the results with them, so that they, understood the results and why we're doing what we're doing. We also kind of have specific policies for those sorts of things. So if it's a recall, we have, a strict policy that we follow. And so, it makes it a little bit easier communicating next steps with them, because, it's consistent every single time, and we know what we're doing and we're prepared. If it's something like excluding food workers, again, we kind of talk with our epidemiologist folks and, communicate with the restaurant and explain, what could happen if they're not excluded. And I think that's always important when you're talking about next steps. Also explaining about, worst case scenario if they don't follow through, right? So if you don't do what we're proposing for next steps, what could happen? And I think sometimes when they understand the science and they understand what could happen, if they don't follow through with next steps, I think it usually kind of pushes them in the right direction to follow those steps.
Doug or DJ, anything you'd like to add?
I think it's, pretty similar to what Brenda Lee talked about. I think for us, I talked about public disclosure earlier, but a big part of that is, so part of our team actually includes our communications team. So, right from the beginning, when we have a request for investigation from our CDEPI folks, we have a high degree of confidence that they've done a lot of vetting, and this has made it to the point where this really requires some significant action on behalf of environmental health. But communications team representative is also included. And the reason for public disclosure, a big reason for that is if you get information out there relatively early, we have found that actually the media will go to that first and many of their questions get answered. So you end up in the long run having to do less interviews. Now, that doesn't mean that questions still won't come from, whether it's newspaper or television media, but King County has found it to be highly beneficial to have that to deflect some of that. So I just kind of wanted to mention that in case anyone was wondering about public disclosure. I know it can be a controversial topic, but I think including communications, right away in these situations is highly beneficial. For other discussion points, I think, outbreak investigations are super dynamic. You can go in with the best information and intentions, but things can change at the flip of a coin when you're out there. So that's why we've installed, much like what DJ talked about, communication. So, I'm basically, if I'm not out in the field, I'm on my cell phone supporting the team and the senior and the experienced investigator that's out there as part of the FIT team to make sure that, we're all on the same page and we're all approaching what we're going to do, whatever regulatory action we're going to do in a consistent manner that matches our policies and procedures. So I think that then, is the best and most objective way to be fair across the board to all operators.
So just out of curiosity, when you're having these conversations with operators, I know my experience at least a few times was we would when we started seeing signals that something was happening somewhere, we might do an early conversation. We may not even go out yet, but we might do an early conversation. And we had times where the operator said, well, do you want me to stop selling this right now? And while we didn't say we can't, we were very clear we couldn't require you to, but there were times when that mitigation measure that they were willing to do definitely prevented, in some cases, hundreds of illnesses. If they were willing. Do you guys see that happen sometimes when you're talking to the operator and they ask the question, hey, should I do something now, and just as a holding pattern to minimize any potential risk? Do you hear that when you're talking to operators?
Yeah, we've had people ask that very question, and we'll just say, you know what? It may be in your best interest. I don't have any, as a regulator, I don't have any further information at this point. We just know there potentially may be something, but it may be in your best interest to just temporarily suspend serving that product. And so, oftentimes what we try to do is we just try to get people to voluntarily do things, because voluntary compliance, I think most of us would agree, is the way to go. If you can get voluntary compliance, that's huge. And it's a lot less stressful for everybody than mandatory compliance. So yes, to answer your question.
Others, were you?
Yeah, we've definitely seen that here too. And I think like another good example is, let's say it's something like a multi-state outbreak and there's a food implicated, right? And there's a recall, but it's only on that one specific lot. And so when we go to the establishment, they may say, well, what about all these other lots? And we're, should we just get rid of all these lots? And, we kind of, same thing. It's, can't tell you to get rid of all of these lots. Historically, we have seen recalls expand. And so then sometimes they also, voluntarily will just get rid of other items. And then, usually in those situations, we do see them expand. So we definitely see that a lot where, if we're even looking into something, it worries the operator and they want to, get ahead of it and either stop selling that product, remove it from the shelves and get rid of it. So it's very common we see that too.
DJ, similar in Tennessee?
Yeah, similar experience with Doug and Brenda Lee. Actually, we were involved in, it was a small multi-state outbreak, but I don't know if you all heard about that. It was the cashew brie cheese.
Oh, yes.
Not a lot of cases on that one. And we actually had only one. It was a little a really cool wine and cheese bar, a new kind of up and coming area in Nashville, that they were the only facility that had that particular cheese. And so we went in there, it was very early on. And it was one of those things, we had two cases and both the cases reported eating this very unique food ingredient. So we were fairly certain something was going on there, but again, did not have all of the backing. And we were working with our FDA partners already, and we wanted to get in there and get some cheese samples. And we went in there, secured their cheese, and we had the same question asked. But I think, and the facility ended up, holding all of that cheese and not serving it. But I think one reason why they got to that voluntary decision to not sell it anymore was because of the background that we provided them leading up to why we were there in the first place. And, when they asked me that question, hey, should we stop ordering this or selling it? My response to them was, there's no official recall on this food, but we're not here by chance. We're getting some pretty interesting signals. And, if this is my business, I would be concerned to sell the food. Ultimately, it's up to you. But, we're getting some strong signals, and I can't tell you to not sell it. But, given the information that I gave you, it's your decision. And I could tell you, if I was in your shoes, I would seriously be considering holding that food and not distributing it to my customers anymore. And usually they voluntarily will hold that food at that point.
Yeah, I think the truth is most of the time people want to do the right thing. The outliers are out there. So we do have a couple questions from the audience. And the first question is there any kind of video training available that goes through the eyes of the inspector? I was going to suggest the EATS training because it's a virtual avatar based training. Well, not exactly video, but it really does go through the eyes of the inspector. Others that you all might recommend?
Yeah, I think that virtual eats training is one of the best ones where, yeah, you're an avatar in a scene and you get to go and try to pick different targets and walk through an outbreak example. And then there's also a sampling training section to that series that's wonderful. I really don't know of anything much better. And then I know through Centers of Excellence, there are some really good environmental webinar or web-based trainings. If you go to the Centers of Excellence webpage, you'll find a number there. I know Tennessee has a specific environmental assessment training series. Might be a good supplement or addition to the EATS training for that virtual, type of online training. And then, I mean, I know a bunch of the other cities are cranking out, different trainings. I think New York has done a bit of work on actually addressing, conducting good interviews, some tips and pointers for that you may be able to find there. So, outside of the assessment piece. So I would look at those COE resources.
I believe someone from Cornell Extension, I don't remember, I thought, so Cornell in New York, thought someone did a pretty good presentation at one time. I just don't remember who the professor was, but there may be some information there too.
Yeah, I think Dr. Weedman probably. And they do have some great resources there on sampling and other things through the Cornell Center of Excellence webpage. So definitely something to look at, the New York Center of Excellence. The next question that we have here is, are there any new apps, websites, links out there that really could assist an inspector? Something that you've maybe learned about in the last 6 months as you're like, oh, I wish I would have known about this, or boy, this is helpful. Any of those sort of things out there you would recommend to the audience? Brenda Lee, do you want to start?
Yeah, sure. So one app that I think is really useful, I believe it's called the Food Cultural app. That's FDA. I think it was actually made in Tennessee. So sorry, I hope I'm not stealing your thunder, but I think that is a great app because there's some foods in there that really outline the risks and foods that you may not be familiar with. So I find that app is incredibly useful.
Yeah, absolutely. Other suggestions?
I'm kind of a Luddite. I hate to say it, but I'm not aware of too much technology, but I just wanted to add that one thing we're going to work on going forward as part of our stakeholder meetings we have in accordance with FDA program standards is we want to proactively kind of walk our operators through what an outbreak investigation looks like before they ever have one. So I think that may be something other programs may want to think about is kind of, set the stage before it actually happens to them. And hopefully they'll, that will kind of help clarify many things for them. And so I hope, this is something we're sort of in the initial stages of, but I hope at some point I can kind of share back at some time in the future with this group about what that looked like and what the reception was. And ultimately, did it really make any difference during an outbreak investigation? So I think that's something we want to kind of cook up a little bit and see how it works.
Yeah, that's a great idea. DJ?
I think there's a link, and I saw it pop up yesterday, but Iafp's procedures to investigate foodborne illness has a really elegant grid chart laying out the food setting that you're in, whether it's farm, markets, or retail, and then the food commodity, and then a grid of, and then down the column is a list of, viruses, bacteria, and then you can follow that column along to find principal contributing factors, and you can pull it up, in the field if you need to, but we generally will look at that before going into the field if we have a suspect pathogen and a food commodity, and look at those contributing factors. And before we even step foot in the door, even with limited information, say it's a complaint-based environmental assessment, and we don't have a lot of epi data, we're still trying to generate those hypotheses before we go in there. But that Iafp link, I think is just, it's a great tool, and it gets you in the mindset, like Brenda Lee was talking about earlier, your goal of being there is to identify those contributing factors, figure out what they are, and get control measures in place, and the subsequent environmental antecedents to the root causes behind those contributing factors. So that's a great tool that we use all the time, and it's great in bedtime reading as well.
Absolutely. Well, we are basically out of time now, but I do want to thank all of you for participating and go through kind of the list of what I heard is some best practices for everyone to think about as they're working on modernizing or improving their foodborne illness program. Food illness response program. Each training is essential. I think everyone agrees that's very worth it. I also heard a lot on making sure you have the right trained leaders that have those investigative skills and really are passionate about doing the investigation. We also heard, definitely sending multiple staff on an environmental assessment. One is not enough. Two is good, and three may even be better. So send at least two is the good thing. I think we also heard a lot about communication and the importance of communicating with the operators early and within the team. So talking to everyone, making sure everyone's ready and understands what's going on, but also helping the operator to understand what's happening and how that may impact them. Well, I want to thank all of you for this conversation. I think we could go on the rest of the afternoon, and I would probably have 24 more questions for you all, but we are going to turn it back over to Pat for the next group.